So this is the portion that we talk about patients' voices and the caregiver voice. But before we get into that, there's a few announcements I have to make. We are at $19,000 for the walk. We really like to see that $10,000. So if you can get on after this meeting and sign up for the walk, it's $25 and you get a hat, and $40 you get a t-shirt. Like I said, if you can make a donation of $5 to any of the team members, that'd be great. We have a $10,000 matching fund, so we really need the funding to keep these programs going. I hope that this meeting really helps some of the newer patients to get a better perspective on their journey, because I know that it helps me every time I have these meetings. I get to speak to patients, and it makes me feel better that we're able to help you. Another announcement is that in the store, on the Zebra store on our website, if you use the code virtual Zebra number 2, and the number 2, you get 20% off of the Zebra store on all merchandise until I believe it's 2 weeks we have it open. I just also want to go over the Facebook pages. Facebook is really, really great in a lot of ways. It has connected a lot of patients together. I just want to use a word of warning. When using the Facebook pages, please be careful, because remember that these groups are mostly run by other patients and caregivers. They are not to give medical advice. Always check with your physician before trying anything. Like I said, especially medications or anything that seems a little bit off, please double check. And whatever you do never, ever, ever, ever share your personal doctor records, okay? The only people that should be looking at your records are yourself and your physicians. Do not put them over the internet, because they get stolen and people can use them for fraud. So make sure that you never, ever, ever give your medical information or lab reports or scan reports or anything like that over the internet. So I want to first welcome my panel here. Katie and I go back a very long time. When I got diagnosed in 2001, and we were on ACOR together, and we were on AIM together. That's long before Facebook and all those other groups. And Katie is part of our advisory board. And we have Wendy, who is a lung noise patient, who is also on our advisory board. Wendy, how long have you been with us? 4 years?
Yep, 4.
4 years. And then we have Chris and Alicia, who are a married couple. Chris is the patient for 9 years?
8 years.
8 years. Close enough.
2012.
Okay. And so I'm just going to be asking a few questions, and just if you want to give a little bit of your history. So let's start off with Katie. We'll make it a short version, because Katie's been doing this since 1999, so it's a long history. So go ahead, Kate.
So I was diagnosed at 19 after having symptoms since I was about 10. They were most noticeable. I was misdiagnosed as colon cancer. Come to find out it wasn't. Went down to NOLA, got properly treated, and multiple surgeries. I do have syndrome. I am on lanreotide. I do have liver tumor burden now. But other than that, 21 years in, and I'm just keep trucking.
Okay. And Katie is a chapter leader in Oklahoma.
I am.
So, and she also runs several support groups on Facebook. So look her up. And if you have any questions, Katie is my backup when Robert and I have to be away and Trisha can't answer the phone. Katie will answer the phone for us, and we're very grateful for that. Thank you.
Thank you.
Wendy, just a brief story, and maybe why you feel it's important to be an advocate, and why you feel it's important to be part of NCAN.
Sure. So I am a lung primary diagnosed when I was 25 in 2005. And why I feel that it's most important to be associated with NCAN is exactly that. I can, as well as learn to be an advocate for myself. I feel like I've had so many instances where I can contact other patients and give them the advice that I didn't get to have when I was first diagnosed. So I feel fulfilled that I'm able to direct someone, which is what I was missing when I was first diagnosed. So I feel very, very fortunate to be able to share my story with other patients, and be interconnected with NCAN and you, Marianne. So thank you.
You're welcome. Thank you. Chris, a little bit about yourself.
I was diagnosed in 2012. I had been symptomatic for almost a decade prior to. I think everybody shares common stories about misdiagnosis, whether it's Crohn's, irritable bowels, learning how to manage stress and whatnot. But it was really, a visit to one of those urgent cares where they saw something on my scans. Next thing you know, I'm in the hospital for 3 days. They tell me I have a net tumor, but I'm like, is this cancer? I didn't hear the term cancer until 4 or 5 months later when I started seeking treatment at Ohio State. I had had a surgery in Oklahoma. They had missed my primary tumor, but removed a cluster of cancerous lymph nodes. But when I was in Ohio is when they actually put me through TACE, as well as was able to take out a primary tumor that they were able to find. So, although I do have burden back in my liver right now, I've not had to deal with any major surgeries in the past 7 years. So, yeah.
That's good. That's good. And Alicia, being Chris's partner in caring, what advice do you have for caregivers?
Listen to your partner, your spouse, whoever you're caring for. I've learned a lot from Chris because he is definitely an advocate for himself. And I've learned things on my own as well. He was the one that actually sought you guys out. And I've actually learned more just by, getting to know you guys and exploring things on the NCAN site, on the Facebook sites. But just really also as a caregiver, yes, the patient a lot of times will be an advocate for themselves, but you also have to be an advocate for them. That you want to be there and show up for them. Early on, I would go to all of the appointments with Chris, regardless of what it was. Because there are times when if they keep getting information, more difficult information, sometimes you need to be there to stand up for them, because they can get so overwhelmed. I remember there was, we were in Oklahoma, we'd actually gone back to see the specialist there, and he'd come in and he wasn't really clear on what the notes were, and he delivered news that actually wasn't correct. And, Chris, it was like, because it kept compounding, and it was like, that was the last straw. And I was like, okay, you need to figure this out for real and come back, because my husband's freaking out right now. So just being there as an advocate, in addition to, because they are going to advocate for themselves, but being there, that you have a united front, and you ask a lot of questions.
Yeah, that's true. Yeah, I think it's really important, that when you go to these doctor's appointments, you bring somebody, or you ask for to be able to record them, and stuff like that, so you have something to go back to. Because I think that a lot of us, honestly, when the doctor walks in, I don't think that we do it on purpose, but I think a lot of us will see that white coat and just say, I'm not going to tell them everything. How's your diarrhea? Oh, it's fine. How's your stomach pain? Oh, it's fine. Because it's a very strange situation, but I think that, we're always afraid to disappoint the doctor and say, I'm not really feeling that great, because you don't want them to feel bad that they're not treating you the right way or something. I don't know. It's crazy. But it's really important that you advocate for yourself, and that your spouse advocates, or whoever your caregiver is, whether it be a spouse or a family friend or a child or whatever. I think sometimes as patients, we have a tendency not to want to get people involved with it, but it's really important that you have somebody to share your story with, and to advocate for you. It's okay to ask for help. And that goes for, it's okay to ask for help as a caregiver. You need to remember that there are times when, you have to walk away from the situation as well. And maybe it's, going out to the store and buying something for yourself, or going and getting your hair done, or just going out for an hour or two, just for a drive, just to clear your head, because that works both for the caregiver and it works for the patient too. Sometimes you just need to clear your head and take care of yourselves. And, I get really worried sometimes about caregivers that they're so focused on taking care of us, the patient, that they forget to take care of themselves. And whether you're a patient or a caregiver, you need to stay on top of things and remember to go and get your flu shot, and go and get your breast exams, and go and get your pap smears. And the guys, you need to go and get your prostate. And, you say, oh, I'm a lung net, I don't have to worry about going for colonoscopies or anything like that. No, that's not true. You need to go and get your colonoscopies. You need to follow up on these tests. And we need the caregivers to also follow up on these tests, because if something happens to you, then, we'll feel guilty that you didn't go and do what you needed to do. So, as an advocate and as a patient and as a caregiver, make sure that you take time to yourself and you take care of yourself, because that's really, really important. If you're having a really bad day, and it's lasting more than a few days, reach out to somebody to go speak to. There is no shame of speaking to a psychologist or speaking to a social worker, and there's no shame of having to take an antidepressant or anything like that. I think that whole thing of the mental capacity it's a shame, because it shouldn't be that way. It should be able to talk about it. Hey, I'm having a bad day. I'm having a lot of stomach pains. I'm having a lot of diarrhea today. It's all right. Or, a caregiver saying, I just can't deal with the word net anymore. I don't want to hear about your diarrhea anymore. I don't want to hear about all this stuff. It's okay. You can have a bad day, but just don't let it stay too long. Reach out for help if you can't get it under control, and know that there's a hotline here and that we're here to help in any way possible. We have a really great team. We have great advisors that are willing to step up and help you in any way you can. And we really appreciate you guys sharing your story. And we have in the rooms, in the chat rooms, we'll have a caregiver chat. We'll have a PNET chat, and we'll have an MEN1 chat. So after this meeting, if you'd like, you can go into that chat room and go into the Zebra Lounge, and they'll put you into a chat room. So now what I'm going to do is I am going to make an announcement, and there'll be 5 gift cards given out for $15 each. I'm going to ask you to send me an email at info@netcancerawareness.org if I say your name. So there is Ruth Hawks, Shane Peters, Virginia Brown, and we have Daryl White. That was 5. Woo-hoo!
I didn't.
Right? Did I catch the 5? I think I did. Okay. So we're going to close now. And thank you again for being here. Again, please, please, please stop by the sponsor booths and exhibit hall and talk to everybody. And visit us at the chat. And don't forget to sign up. On November 21st will be our next virtual meeting. Thank you, guys.